Okay, so today we're really diving deep into this fascinating world of clinical trial budgeting.
Okay.
And we've got this really interesting article from the Global Costing Task Force. And it's specifically for people who are, managing the money side of these huge research projects.
Yeah.
So we're going to figure out what is it about this cost per patient thing that has them so fixated?
Yeah, I mean, it's a big deal. Like, if you can imagine, like, you're leading this trial for like a revolutionary new treatment, for cancer, and it's like really promising.
Yeah.
But then suddenly the costs just explode, and it just like jeopardizes everything.
Yeah, the article really drove that point home.
Yeah.
I mean, they said
they did
that you got to be watching that cost per patient number. Yeah. Like a hawk with a calculator.
Yeah, like a hawk.
So why is that?
With a calculator.
Why is that number so crucial?
Well, think of it this way. Every clinical trial, it's like this big puzzle.
Okay.
Right? And like patient enrollment is like this constantly shifting piece.
Right.
You might plan for a certain number of people.
Yeah.
But then real life happens. You know, people drop out.
Yeah.
Maybe there's like new challenges with recruiting people.
Yeah.
All of that impacts the budget. And if you're not super careful, those little ripples, they can become like giant waves.
So then what happens when those costs start
what do you do
to like creep up?
Well,
what can they do?
There are some things you can adjust.
Like what?
The article mentioned something about site allocation.
Site allocation.
Yeah.
What is
What is that?
Well, basically it's
where you choose to run your trial.
Okay.
Different places have different costs of living, different, costs associated with them.
Well,
like, for example, if you run a trial in a big city where there's lots of specialists and stuff, that's probably going to cost you way more than a similar site in like a smaller town.
Right. So you're trying to find that balance.
Exactly. Finding the right patients.
Right.
But also like
keeping the costs reasonable.
Yeah.
But like you said before, enrollment can be so unpredictable.
Yeah.
Doesn't that make it like almost impossible to budget accurately?
It is. It's a big challenge. And that's something the article really highlighted.
Okay.
Teams, they often underestimate how much enrollment can impact things.
Yeah.
It's not just the cost per patient itself, but it's like a ripple effect.
Right.
It affects staffing, the timeline. If there are delays, that means you need more resources. More resources means more money.
It's like a chain reaction.
Exactly.
Are there other budget areas that tend to catch people off guard?
Totally.
Besides the enrollment?
Yeah, like data management.
Yeah.
Huge one.
Okay.
I mean, think about it.
Yeah.
You've got mountains of data.
Yeah.
Patient records, lab results, and you got to make sure it's all accurate and secure.
Right.
That is a massive job.
Yeah.
And then you've got regulatory compliance, which is like a whole other beast.
Yeah.
So much documentation. You got to follow all these guidelines. They're always changing. And for all of that, you need specialized people, specialized systems, which means more money.
It really is amazing how much is going on.
It is.
Behind the scenes.
Yeah.
So if I'm understanding this right, it's not like you just make a budget and you're done. It's like you're playing
that's a game.
A high-stakes game of Tetris.
Yeah, like Tetris.
You're constantly adjusting.
You got to be ready.
To whatever comes next.
To pivot when the unexpected happens.
Exactly.
Yeah, so it's about like anticipating those pieces, understanding how they all fit together, and being ready to adapt.
And as we move more into this digital world, I'm thinking about all these technological advancements, like telehealth and remote monitoring.
Yeah.
How could that reshape?
Do they change things?
Will they make things more efficient?
Could they make trials?
Could they save money?
More efficient and cost effective.
I think so.
Yeah.
I think that's something to think about.
Something to ponder.
Yeah.
Yeah.
Definitely.
Well, on that note, we'll wrap up this deep dive into clinical trial budgeting.
Sounds good.
Thanks for joining us.
Thanks for having me.
And we'll see you next time.
See ya.
For another deep dive.